So tell us about your project, a little bit about who you are.
So my name is Conrad. We initially did our project in Southampton General Hospital, and it was aimed to improve the VTE prevention compliance. So our first audit found that there was a low compliance rate of only 66% to the local guidelines. So we weren't really sure what was actually happening, why this was happening, so we investigated a bit further. And this highlighted several areas for improvement, mainly a lack of awareness and lack of accessibility with risk assessment forms. There was also lack of ownership to who should be checking the forms are correctly done. This was the main issues we found. So we thought that implementing simple changes would be most beneficial because it would actually happen more quickly. And most importantly, I think we wanted to use a more multi-disciplinary approach. So first we raised awareness of the ward staff by simply circulating email and presenting the findings at the MDT. We also had introduced specific VTE prophylaxis topics for the local induction for the staff. We improved the accessibility of the risk assessment forms simply by having them pinned to the admission packs, and this was with the help of the ward card. And we also involved our nurses and pharmacists, who would be more encouraged to highlight outstanding VTE issues to our ward doctors on the day.
And with all these changes made, what was the final outcome with your re-audit?
There was a significant improvement of the compliance rate to the local protocol. So initially from 66% to 88% in a month's time. Generally all the staff in the department were more vigilant about VTE protocols. The nursing staff felt more able to highlight any issues to our doctors. We also actually re-audited another month later to check how sustainable these changes are. And we found a further improvement from the 88% to 90%.
So what's the key message you want to tell others who are interested in perhaps starting up a similar quality improvement project?
So I think you have to look at the whole, how your ward is functioning. But if you actually look at it carefully and plan it carefully, you can actually find some very simple ways to make changes. Simple changes, people tend to be more receptive to implement these. And especially for a junior doctor, you don't have to implement a huge change the whole service, especially. Next thing is, the second important thing I want to get across is that you really would want to involve a multidisciplinary team in your work, because who's looking after the patients? It's going to be nurses, it's going to be pharmacists, it's not just doctors, it's not just one single profession. So everyone really should work together to try to have a common goal.